Hi, my name's Holly, and I have been with, oh gosh, Dr. J for so long. So I actually was a rep for one of the procedures that they do here originally, and so that's how I met her, and that was probably, gosh, I'm gonna go with 25 years ago at least. Working, as a rep for them, and working with their patients as well, I kind of got to know who they are, and I just really, like them as physicians and their ethics, how they treat their patients, etc. I mean, they're just really good people. I started slowly, kind of getting into, Botox, and I didn't really do fillers, but I started with Botox, and so I've been seeing her for probably 25 years. And, as the years progress, I started doing more and more things, but primarily nothing surgical. And then, finally, there was a point that I think our relationship was so good that, and I would see her every year or more than, even more than that. I mean, I'd see her quite often. But, every year I talk about, wanting to finally do something surgical. And so I think just that relationship that we had made me feel so comfortable in finally doing it. At some point, I was staving off what I knew inevitably I wanted to do. And again, it's a very personal choice when you want to do something surgical, which is why I think it took me so long. And finally, she just said, I think you should finally, you should do it. You're going to really wish you did it earlier. And I do wish I did it earlier. So when I sat with her, originally it was my neck that really bothered me the most. And that's where I started was I wanted to just get rid of I had a lot of skin. Wanted to get rid of all of this. If you see the before photos, look at the before photos, you'll see, I mean, I can pinch probably like 2 inches out here. And then, because we have a good relationship, she didn't feel uncomfortable. I never felt pressured to do anything more than what I wanted to do ever. But she's like, you might also want to do this, do that. And, it was completely up to me. And in the end, I did it all because I really, really trust her. And I think that was a big part of it. I just know that she was going to do the best for me, and the amount of photos she takes before, even right before the surgery, so that she can look at them, while you're on the table even, having the procedure done. She wants to make sure, okay, well, because you're lying flat, you can't really tell because your anatomy changes. She wants to look at those photos that were just taken to see how things fall, And I think she did just an amazing job because she cares so much. So I did a blepharoplasty, which both upper and lower lids. I did a lift, a temporal lift. She suggested doing some fat transfer, which has been amazing. You can't even tell, but you probably can because you just look at the before. And up in this area, it's so natural looking. And, she put a little bit, I think, in my cheeks. And when I say I think, because I just said, she even put some in my ears, my earlobes, because, I would have never thought that. But now I love it. I was like, wow, yes. So everything that she did, then she did the neck lift. And when she did the neck lift, she also did, I guess, with a facelift. So she did it with just around the ears, and in the front there's nothing, you can't see anything, and in the back is hardly anything. It's just and it's been, I guess, about 8.5 weeks now, and the scars are just fading beautifully. Even here, like you can't even tell, but here I don't even see that. They're so hard to find now, you don't even see them. And around here, it's very, very light. I felt so comfortable with her, and the staff. They're just amazing. So I did it in 2 parts because Dr. Cheng, after we had my initial consultation, she thought, afterwards, because I did decide to do everything. She called and she said, I think, and she knew my hesitation about being under for so long. So I think she felt, why don't we do this? Break it up into 2 surgeries. And I'm like, okay, again, I wholeheartedly trust her. And and it was definitely the right thing to do. So the first one was a blepharoplasty, and that one was actually the early morning, believe it or not. I had to come in at like 6 and meet with Ashley, who's amazing, by the way. Her entire staff is amazing. They're so gentle and caring, and just the demeanor, everything about Ashley, I love. And she just really, she holds your hand, and she's the one that puts in the IV. She just, and you don't even feel it. And she's just, she preps you beforehand, and then, Dr. J comes in and, marks you up to see exactly, what she wants to do while you're upright. They take a ton of photos, and then they just bring you back. And the anesthesiologist is amazing. It's a comfortable bed. It's heated. You wake up and they just take care of you, and you go home that day. I also hired Adina. I love Adina. She took me home and she stayed the night with me, just because it's just easier than having it's totally fine to do it all yourself. It's just, I didn't want my husband to have to do it. For the eye one, you have areas that you should change the icing, every few hours. And she was just amazing. That recovery was nothing. I think 2 days later, I was absolutely fine. Like going out, not going out, but if I wore sunglasses and a hat type of thing, not a problem. My recovery was textbook practically. And again, I think it's because of everything she has you do in advance, everything that they have you do during. Having Adina for the night helped, and having everything done properly. We did the second surgery a week later. I came back in, and I came in a little bit later. I think I came in at 7:30, which is a little more reasonable. And that surgery was a little bit longer, but that would have been the neck lift, the facelift. When I came in, again, everybody, Ashley, they just really assuage any concerns that you have or feelings that you have. They're amazing. And again, lots of photos, lots of, before, like that was probably 2 hours before you even go in for the surgery part, just the prep part. And again, that surgery was a little bit longer. I think that one was more like 6 hours, maybe even 7. But amazing, just absolutely amazing. And that when you go home that night again, you go home, but you don't do anything, because it's more, the bandage is kind of fully encased around this way, and there's not really anything you need to do. So there was no reason to have it, but I did have my daughter taking care of me, and that was just more making sure to take my meds. And again, I never had any pain with either of them. I think I took my meds each time, maybe a day and a half, 2 days. I stayed on top of anything. And then after that was just some Tylenol if I felt anything. But I never ever had any pain with either. It was more for me was the uncomfortability of having to sleep on my back. I'm not a back sleeper, I'm a side sleeper. So now I'm a back sleeper, but it took me 9 weeks to become a back sleeper. And then the neck sling thing was very uncomfortable for me, but you do what you got to do. It was just uncomfortable. I can't say enough about how amazing these guys have been. I saw her every week, and even twice a week sometimes if I wanted. They're just always available and always just amazing. And they just make you feel so good every time you come in here. They're just so nice and friendly, and they remember your name, and everything is just beautiful. And so if you're even contemplating any type of procedure and you have hesitation, these guys will have my phone number. Feel free to call me if you want to, just talk to me about anything. And I'm quite honest. I'll tell you whatever. I love the results. I cannot tell you enough how much I get up in the morning and I no longer have all of that extra skin, and yet I still feel like everything looks pretty natural. And it's just so nice now to not have all that extra skin and just look so old for me, because that's not how I feel. I'm so active. I don't feel as old as my age. And it's so nice to still look natural and feel younger feeling. I have so many friends that have said, God, your skin looks so good. What did you do? Oh, I forgot the CO2. That was part of the second one too, which again is not bad at all. And but it's just made my skin glow. And literally when I have no makeup on, it just glows and it's just really nice. And so that has felt really good. And then I tell them what I did. They're always like, oh my God, I have to go there. Like they're like, what's her name? Where is she looking? I'm like, just right here in Saratoga. It's great. But that has felt really good. And my makeup now I feel like I just feel like how I feel inside now. I feel like I look a lot younger, which has really been nice. I'm not going to say it's made my confidence better, because I've always been very confident, and I didn't do it for anybody else, but for me, because just looking in the mirror every day and seeing this extra skin just bothered me. It bothered me for 3 years. That I finally did it. I just do anything Dr. J says.